Welcome back to AfyaWingu Healthcare Management System. In this video, we'll walk you through Section 2, Vitals, where you'll record the patient's key physiological measurements to help assess their condition and guide clinical decisions. You're still viewing the record for Maxwell Wright, age 20 male, with visit date November 25th, 2025. We've just completed the chief complaint section. Now it's time to capture his vital signs. At the top of the screen, you'll see the tabs again. We're now on 2 vitals, which is highlighted in blue. Let's go field by field so you know exactly what to enter and what's considered normal. Section B, Vital Signs. This section is divided into 12 fields, all essential for assessing a patient's current health status. 1. Heart rate, BPM. This is the number of heartbeats per minute. Example input, 100. Normal range, 60 to 100 BPM for adults. High could indicate fever, anxiety, or dehydration. Low could indicate shock, hypothermia, or medication effect. Tip: if the patient is anxious or just walked in, wait 2 minutes before measuring for accuracy. 2. Blood pressure, systolic, diastolic. Enter 2 numbers, systolic, top number, pressure when heart beats, diastolic, bottom number, pressure when heart rests. Example input, systolic 120, diastolic 80. Normal range, less than 120, 80 mm Hg. High could indicate hypertension, stress, or pain. Low could indicate shock, dehydration, or blood loss. Tip: always enter numbers only, no letters or symbols. The system will auto-format as 120, 80. 3. Respiratory rate, breaths min. Count how many times the patient breathes in and out in 1 minute. Example input, 18. Normal range, 12 to 20 breaths per minute for adults. Fast could indicate fever, asthma, pneumonia, or anxiety. Slow could indicate drug overdose, brain injury, or fatigue. Tip: count silently while pretending to check the pulse. Patients often breathe faster if they know you're watching. 4. Temperature. Enter the patient's body temperature in degrees Celsius. Example input, 40. Normal range, 36.5 degrees to 37.5 degrees. Fever? Anything above 38.0 degrees could mean infection, inflammation, or heat stroke. Hypothermia, below 35 degrees Celsius, could indicate exposure, shock, or metabolic issues. Tip: always note if taken orally, axillary, underarm, or tympanic, though the system currently defaults to greasy. 5. SpO₂%. Oxygen saturation measures how much oxygen your blood is carrying. Example input, 92, normal range, 95 to 100%. Concern if 94% could indicate lung disease, pneumonia, asthma, or heart failure. Tip: use a pulse oximeter. If SpO₂ is low, recheck placement and ensure patient isn't moving. 6. Pain scale, 0 to 10. Ask the patient, on a scale from 0 to 10, where 0 is no pain and 10 is the worst pain imaginable, how would you rate your pain right now? Example input, 8. Interpretation, 0 to 3, mild pain, 4 to 6, moderate pain, 7 to 10, severe pain. Tip: always document both the number and the location type of pain, e.g. 810 sharp left side abdominal pain. 7. Blood glucose mMol per L, used mainly for diabetic patients or those with suspected hypoglycemia. Example input, 6.8 normal fasting range, 3.9 to 5.5 mmol per liter. High, greater than 7.0, could indicate uncontrolled diabetes. Low, less than 3.9, could indicate hypoglycemia, especially if patient is sweating, confused, or dizzy. Tip: use a glucometer. Record time of last meal if possible. 8. Capillary refill, seconds. Press on the patient's fingernail or sternum. Then count how long it takes for color to return. Example input, 3. Normal range, less than or equal 2 seconds. Delayed, less than 2 seconds, could indicate poor circulation, dehydration, or shock. Tip: do this in warm room. Cold hands can give false results. 9. Weight. Enter the patient's weight in kilograms. Example input, 70. No universal normal, depends on height and build. Tip: use a calibrated scale. Record if patient is wearing shoes or heavy clothing. 10. Height. Enter the patient's height in centimeters. Example input, 170. Important for calculating BMI and dosing medications. Tip: measure without shoes. If unsure, estimate based on known data or ask patient. 11. BMI, body mass index. This is auto-calculated by the system using the weight and height you entered. Example output, 24.2 if weight equals 70 kilograms, height 17 meters. Interpretation: underweight, less than 18.5. Normal, 18.5 to 24.9. Overweight, 25 to 29.9. Obese, greater than or equal to 30. Tip: don't worry about entering this manually. The system does it for you. 12. Live interpretation panel, right side. As you enter vitals, the system updates the live interpretation box on the right. In this example, it's flagged fever because temp equals 40 degrees Celsius, low SpO₂ because SpO₂ equals 92%, hypotension because BP may be low, though not shown here. These are automatic alerts, helping you spot red flags even before you finish the form. This feature is especially useful during busy shifts or for less experienced staff. Save your work. At the bottom left, click the blue Save Information button after entering each vital sign, or at least after completing the whole section. Clicking Save ensures everything is recorded and visible to the next clinician. You'll also see Last Saved, November 25th, 2025, updated by Malaika Center. This helps track who entered what, important for accountability and continuity of care. And that's it for Section 2 Vitals. Once you've completed this, you're ready to move to Section 3, HPI, to document the full history of the patient's current illness. Section 4, History and Safety, to record past medical conditions, allergies, social habits, and safety concerns. Section 5, Assessments, to note your clinical impression and plan. Section 6, Administer medications to prescribe or give drugs during triage. Each step builds a complete clinical picture, helping doctors make faster, more accurate decisions. Thank you for using AfyaWingu, making vital signs easy to record, interpret, and act on.